I'm Dr. Ashish Acharya, consultant in sports medicine, Sir Gangaram Hospital. Usually the spine is divided into three parts: the cervical, the thoracic or the dorsal one, and the lumbosacral one. The cervical, that is the neck part, it is otherwise called as the upper spine. The middle is the thoracic or the dorsal one, which is otherwise called the middle part. And the lower one is the lumbosacral one, which is otherwise called the lower backache in common terms. In today's world, it is mostly postural, which is otherwise we call it as a mechanical backache because of the bad posture during long sitting hours, because of our profession. A lot of people in IT or in other jobs, sedentary lifestyle, they sit in bad postures without back support, stooped forward positions. That exactly what causes backache in 90% of the patients that come to my clinic nowadays. The next common cause would be like if you are doing unaccustomed work, like some heavy lifting which you have not been doing since long, and suddenly you need to lift the luggage or anything like that, that may cause the lower back strain and you may cause backache. Then the next other common causes would be the prolapsed intervertebral disc or the degenerative disc. The degenerative disc usually causes after a period of say 30s or 40s, which is the common age group which is involved in the degenerative discs. They have caused a backache, and the pain usually radiates, may or may not, but it may radiate to the lower limbs with tingling and numbness in there. The fourth cause may be spinal canal stenosis or the facetal arthropathy. These are again degenerative diseases in which osteophytes or facet joints of the back, they get degenerated, and because of that patients experience pain. Again, the risk factors would be first back posture hygiene. We would call it as postural hygiene. Sit straight. If the posture is bad, definitely you are going to have a back pain, and once the posture is corrected, everything will be corrected. Second, getting older. The more older you are, the more chances of you having backache. Third, it's because of the poor physical fitness. In our day-to-day life, all of us, almost everybody has a sedentary lifestyle. For that, we don't do exercises much. We don't go for a morning walk. We are not fit enough. Most of the people are obese and overweight. That causes a huge stress on the back. Therefore, physical fitness and maintaining a proper weight and BMI would be the best thing to avoid backache. Diagnosis is pretty. Never ever neglect your backache. Whenever you are having backache or night pains, or if you are having back pains after prolonged sitting or after a night's sleep, then come over to a doctor. It can be diagnosed with simple clinical examination by the doctor. 90% of the backache cases can be diagnosed. Only in very rare cases we would go for some investigations like x-rays, and in still rare cases we will go for investigations like MRI or CT scan, which will be able to diagnose almost 99% cases of the backache. Some very small group of cases which belongs to the genetic or hereditary causes, that may require blood investigations and genetic profile screening for the diagnosis. Best way would be many, like it depends on your work, how to do and what to do. Like we have long sitting hours. If you have long sitting hours, sit with the proper back support. Do not lean forward much. Do not stoop forward. Maintain proper posture, and then if possible, after every 1 to 1.5 hours, take a round of the office in which you are working. Move your neck a little, stretch your back, and then come back and sit for another 1.5 to 2 hours. So that will actually relax your back, and the cause of back pain can be in 90% of cases would be relieved by that only. Maintain proper physical fitness, do the back exercises regularly. Do not indulge in overeating because that would lead to overweight and that will cause a huge strain on your back. So don't indulge in those things.